Blood by Taylor Swift on Hot 89.9.
What a great song. So Christmas is coming up.
Yeah, did you get everyone a present?
Not quite, but for the listeners out there, here's an idea.
Have you ever had that one friend, family member that you hated or that ex that broke your heart? Well, for Christmas, give them rabies in a box. But first, what are rabies?
Okay. Rabies virus belongs to the order mononucleovirales, viruses with a non-segmented negative-stranded RNA genomes. Rabies is caused by genera Lithia virus and Viscariolus virus. Rabies, a member of the Rabidovirus family, is caused by the virus neurotropic Lithia virus. But Cassandra, tell our listeners what the pathogen looks like.
Yes, the pathogen is a very distinctive acute rod or bullet-shaped morphology. It is a single-stranded neurotropic negative-sense RNA virus which encodes 5 proteins, a glyprotein, a nucleoprotein, and 3 others. The mature virus has a bullet shape, a protein code, and a lipid envelope. The outer surface of the virus is covered with a thumb-like glycoprotein projections that is 5 to 10 nanometers long and 3 nanometers in diameter. The virus averages approximately 780 nanometers in length. The virus is found in the salivary glands and CNS of infected warm-blooded animals, including humans. Worldwide, where approximately 50,000 people die each year from rabies, the highest risk of human infection is from rabid dogs.
But how does it work?
In the box, listeners will receive the most common mode of transmission for rabies, saliva from a wild dog. When a victim is bitten by the animal with the rabies virus, the uninfected victim receives the virus through the infected saliva of the animal. It is rare for transmission to be by other routes, yet there have been reported cases of transmission through contamination, touching a rabbinical animal's eyes, nose, and mouth, and aerosol transmission. Rabies is very deadly. Therefore, never approach an animal that seems as though it has contracted the disease. Viewers, be very careful when you are giving someone rabies in a box. Once given the box, leave immediately.
And what are some of the symptoms they are going to receive when given this present?
The symptoms of rabies in animals can typically start out with aggravation and restlessness. Friendly pet dogs will become dangerous, biting their owners at any sight of stimulus. They will lick, chew, and bite at the place where they were bitten and run a fever. Paralysis of the throat and mouth jaws will follow, leading to foaming at the mouth. Eventually, this disease will lead to a sudden death. If a human contracts rabies, the symptoms are quite similar to the flu, including weakness, dizziness, fever, and a headache. Within days, the victim is submitted to anxiety, confusion, and agitation. If left untreated, the disease will amount to delirium, abnormal behavior, insomnia, and even hallucinations. Once the clinical signs appear, the disease is almost always fatal.
Yes, some of our viewers are calling in about this. Tell us more.
Some of the social and economical impact this disease have on individuals and society include: rabies lead to 55,000 deaths per year worldwide. 45% of deaths are in the Southeast Asia region.
Although death is the most obvious consequence of this disease, it is not the only strain put on a country by rabies.
The treatment for rabies is called post-exposure prophylaxis. Although it is cheap to manufacture, it is expensive to administer because it requires trained professionals and hospital resources.
Aside from the direct medical costs, the patient may lose income attending clinicals. Aside from the direct medical costs, the patient may lose income attending clinics for treatments, as may anyone accompanying the patient.
Post-exposure prophylaxis can have long-term and severe side effects, which will affect 0.3 to 0.8 out of 1,000 cases. The side effects can lead to the patient spending between 4.9 and 6.6 months out of work. But what happens if your rabies in a box gets out of hand?
What a good question. There are many ways to treat this. First, a fast-acting shot to prevent the virus from infecting you. Part of the injection is given near the area where the animal bit you if possible, as soon as possible after the bite. A series of rabies vaccines to help your body learn to identify and fight the rabies virus. Rabies vaccine are given as injections in your arm. You receive 4 injections over 14 days. However, to prevent the occurrence of picking up rabies, you should vaccinate your pets. Cats, dogs, and ferrets can be vaccinated against rabies. Ask your veterinarian how often your pets should be vaccinated. Keep your pets confined. Keep your pets inside and supervise them when outside. This will help keep your pets from coming in contact with wild animals. Protect small animals from predators. Keep rabbits and other small pets such as guinea pigs inside or in protected cages so that they are safe from wild animals. These small pets can't be vaccinated against rabies. Report stray animals to local authorities. Call your local animal control officials or other local law enforcement to report stray dogs and cats. Don't approach wild animals. Wild animals with rabies may seem unafraid of people. It is not normal for a wild animal to be friendly with people, so stay away from any animal that seems unafraid. Keep bats out of your home. Seal any cracks and gaps where bats can enter your home. If you have any bats in your home, work with a local expert to find ways to keep bats out. And finally, consider the rabies vaccine if you're traveling. If you're traveling to a country where rabies is common and you'll be there for a long period of time, ask your doctor whether you should receive the rabies vaccine.
If you are still interested in purchasing rabies in a box, call 990-851-2230. The first 100 callers will get their rabies in a box 20% off. Call now. So many listeners are calling in.
Call now so you won't miss out on this deal. Get your rabies in a box today. Sales are always final.